Good afternoon, ladies and gentlemen, and welcome to our webinar on clinical procurement. My name's Scott, and I'm a campaign manager for Sustainability campaign. We are obviously facing unprecedented times in terms of our healthcare across the world and in the UK. Today's webinar is designed really to just examine procurement from a clinical perspective and look at some of the examples in ways that can be supported in the NHS. It's not to detract from the current frontline efforts that have been going on, and we support our NHS professionals, whether in procurement, back office and frontline care. Today is more about understanding the support suppliers and trust can get going forward and in the future. We'd like to have the webinar sponsored by Vanguard as one of our members. Founded in 1998, Vanguard AG is a Berlin-based medical company that develops CE certificate state-of-art, high-quality remanufactured single-patient use medical devices. They became a member quite recently, and Paul Broadbury will be one of our guest speakers today, and he'll tell you a little bit more about what they're doing and how they support the NHS. And we'll hear from Paul shortly. But on to our first speaker. We've got a lineup today of 3 speakers, including Paul, Daniel O'Connor from Warpit, and our first speaker of the day will be Neil Hines, lead corporate services at the Greater Manchester Health Social Care Partnership. Neil recently picked up a procurement award for the Sustainability Day Awards held on March the 19th, and he's going to tell you a little bit more about what procurement means in Greater Manchester, some of the work that they've been doing, and what they're offering for NHS trusts across the region. Over to you, Neil.
Okay, this afternoon, everybody. So what I wanted to do was really just to give you a bit of an overview of what we've done so far, a bit of background on us, what we're thinking of doing next. Now, these slides were written a couple of weeks ago, so I think events have overtaken us so slightly, but we will. We know this is still an important agenda, so we do want to keep these plans on the table when we're able to come back to some of them. And we know this isn't easy, especially in the current circumstances. So I'm going to also talk about some of the challenges that we're facing ahead as well. I think we've got some other questions online as well, but if you've got any other questions, please use the online system to send those in. So it's our vision at the partnership. Those who don't know much about the partnership, we are part of the devolution, the only region in the country that has the devoluted powers over its NHS spend as well. So we can work as a system, and really our main ambition is the greatest and fastest improvement we can in the health and well-being of those people that live in Manchester. There are lots of work that we're doing that, especially in this space around sustainability and being more environmental friendly, that obviously has a knock-on effect on the health and the well-being of the people which live in our region, as air quality and waste being some of the obvious ones. Just to give you a bit of an overview about how we are as a region, we are quite a big chunk of NHS England, about 5.77% of the spend of the country, big amounts of money, 2.33 billion non-pay spend, and we think we can influence about 827 million of that, so we can start to think about how we use that spend a bit better in a more sustainable way. The last set of league tables that were out, for those who look at those things, we had the top 3. We had 3 trusts in the top 10 at the end of 2019. So we've got some very good teams working in the region. We know we were also quite fortunate to have quite quite big teams in some areas. We know the cost of our operation is about 7.6 million, around 224 full-time staff raising 240,000 purchase orders a year. But we also know there are things we can do more efficiently if we work as a region, savings of about a fifth, and we've implemented lots of those are part of the work that we've done, bringing in some initial savings and some ongoing savings there. Savings for last year were around about £3 million in excess of what we thought the trust would achieve anyway under their SIP saving. We got projects up and running in 2018 in us working as a region, and we had agreements at the end of March, sorry, end of February, for a continuation of the work that we were doing to take us through for the next to 3 years. So what have we done so far? We've done quite a bit to get us up and running. We've got a sustainable development leadership group up and running in April. That just a year ago, that was a number of key leaders from the system to give input, help and guidance around what we needed to do, put in place all the governance, and make sure everybody was on board with what we were thinking. In August 2019, as a region, we did declare a climate emergency. I think it was just after Newcastle did, but this was for the entire region, and I think we were one of the first regions that did this. So this included all our trusts, all our CSUs, so that it was a joined up system, a thing that we did. We did some joint work with NHS England at September 2019, where there was a working group set up with a focus around air quality. Again, that just helped raise the profile of the work that we were doing. As a region, we've got a 5-year environmental plan that was approved 2019. Again, just gives us a steer and a remit in getting involved in this. And we've got a lead and an SRO from every NHS organisation now in the region. So we've got a good route to get things out into the system and to get that feedback as well. If you haven't seen it, it's worth having a look at the Nordic Centre for Sustainable Healthcare. I think everyone would agree that those countries in the Nordic area are probably slightly ahead of us and have some very good case studies and information. If you are a public sector organisation in the UK, it is free to actually go and join that, so that's worth having a look at. And we've set up now a number of working groups underneath the leadership group, looking at waste, fleet, estates, energy, etc. Just to give us a real focus on the areas where we know we've got to make a real difference. And I think now, as everyone is, or at least we're doing, all our organisations were aiming to have a sustainable development management plan by this month. Last time I checked, that I must admit was a few weeks ago. At least everyone was actually working on it. I think recent events may have meant some of those haven't gone into the boards they needed to for approval, but I'm sure that will get picked up in due course. As an integrated care system, as an ICS, we've got our own SDMP as well, and this chart here just gives you an overview of some of the things we are looking at. Might give you some ideas of things to have a look at if you haven't got these on your own plans. Lots in the environmental space, state space, as you can imagine, but also more and more going into the medical side of things as well. But as you can see there, quite a lot for us to actually go at. So our story so far, do you want to go through some of the things that we've already done, that we're already on with? We do have a regional strategy and plan that was agreed by our board. I think the pie chart on the right I'm sure is one people have seen before. It's now a bit dated from 2017, but it's still very relevant, I think. The for the people that work in the supply chain, we have a major role in this. You know, we are over half the emissions in the NHS, so we have a massive responsibility to go and look at this and just to see what we can do to bring those figures down. I think now almost everyone will have switched their cutlery. We started this project earlier last year. We knew that our stores and stirrers, we were using around about 800,000 of those a year. The knives, forks and spoons around 2 million, and by switching away from those, we know there's about 600k of plastic that we are keeping out of the waste chain, which is really good news. The project to look at reduction of gloves, we just got this up and running, but for obvious reasons we've just put this on hold. Not quite the right time to encourage people in using less gloves, but we know from the work that we've done, 140 million gloves are used across Greater Manchester every year in our hospitals, cost about 3.8 million, generating 600 tonnes of waste.
Neil, can I just jump in there? And
yes.
Obviously, the glove reduction program is fantastic, and in this current climate, it's obviously the right decision. That is not something that's massively promoted, but on an average, as you said, 140 million are used across in GM, costing 3.8 million. What kind of figures would we be looking at now in this current situation in terms of?
Really good question. I mean, we've not, if I'm honest, we haven't looked at what the increase in usage is. We just know it's a lot more. I can give you some national figures which I'm aware of. So orders going through, and this isn't just on gloves. This is just it's in the PPE and some other type of equipment. We know that orders have doubled during the last fortnight. So it might not be that far away if we say actually they'll have doubled.
Yeah. Do you think that this gloves reduction program, and I mean myself and the campaign have always highlighted the glove situation as being the kind of main driver around sustainable procurement since the National Audit Office report a few years ago, stating the different variations of gloves that have been procured for different consultants and their own choice. Do you think the knock-on effect of what we're seeing now may disrupt these schemes in the future? Not specifically your scheme, but schemes such as that. Do you think there'll be more questions over them now because of this as a consequence?
I think so. Yeah, I think it's going to make any initiative like this much harder. You know, and rightly there is massive concerns of the staff who are on the front line as to what equipment they have they got to the right equipment. You know, is there enough of it? So I think it's probably very true to say, you know, it's going to make the occasional piece around this and the buying of the people who are using gloves a lot harder. I just think we would just have to accept that.
Yeah. Okay. Thank you.
Okay. The other one we're looking at, centralised logistics. I do wish we had this in place now. So we were looking at a single store for our region as opposed to every trust having its own store, and instead of vehicles going into every trust, it will go into a central warehouse, and we would do the last mile locally. Our initial work on this saw we felt there'd be a reduction of over 200,000 vehicle movements off the road. That was just over half. That would obviously come with a reduction in CO2 and NOx emissions there as well. So what next? We've got lots of different things underway, various pilots, and we need to start to turn these into large-scale projects. The first one is